Thank you, thank you. Would you be impressed if I told you that we have medical treatment that can cure some cases of blindness, some cases of hearing loss, and 14 other conditions? What if we lived in a world where we could grow new blood vessels, a term we call angiogenesis? Welcome to my world, the world of oxygen. And when we combine oxygen with pressure, magical things happen that I will tell you about. Now, I have a story about how I got here. I grew up in a little town called Lafayette. It's downriver, down the Mississippi, but it's about 55 miles away. After I finished high school, I went to the local university there, the University of Southwestern Louisiana, the Raging Cajuns. There's a picture of the student union, very pretty campus. So we called it USL for short. And we got the other schools making fun of us because they said, well, the University of Southwestern Louisiana, USL, stands for the University of Slow Learners. So in 1999, they changed the name to the University of Louisiana, Lafayette. And there's a picture of the university with the new name. Now, University of Louisiana, Lafayette, that's a mouthful. So for short now, they just call it Ooh La La. And we're still the Raging Cajuns, and I still wear Raging Cajun ties. So, Alleman, it's not a very common name here. Does anybody know what this name means in French? Yes?
German.
DeMarcus, give him a prize. Very good. So do you speak French?
Yes.
Very good. All right, so if your name was Alleman, which is the French pronunciation, where in the Memphis area would you live? Give her a prize. Very good. So I haven't always lived in the world of oxygen. I started out in family practice. And I was doing family practice, and it wasn't very fulfilling for me. And after 8 years, the hospital I was working for in Shreveport said, why don't you try this occupational medicine? I said, well, I don't think I'll like it, but I'll try it. And surprisingly for me, I liked it. So I started learning more about occupational medicine, and I ended up in New Orleans for this conference, the American Occupational Health Conference. And I ran into an old college buddy of mine, Dr. Bob Bourgeois. Dr. Bourgeois is in practice in Morgan City, Louisiana, as a board-certified occupational medicine doctor. So he encouraged me to get some more training, and after 8 years of doing occupational medicine, I said, maybe I should get some training. And off I went to Duke, where I spent 2 years learning about occupational medicine. When I left, I was looking for a job, and I found a job, lo and behold, in Lafayette, Louisiana. It's a good place for me. And I started my career as a board-certified occupational medicine doctor. And then I started seeing a bunch of commercial divers, people that would dive for a living. So I was wanting to learn more about diving, and I landed up in New Orleans at another conference, the Undersea and Hyperbaric Medical Society Conference, Fitness to Dive. And when I was there, I ran into Dr. LeGros. Y'all know her? She's an emergency room doctor here. She was taking the same course that I was taking. She was the fellowship director for the Undersea and Hyperbaric Medicine Fellowship in New Orleans. So after talking with her, I thought, maybe I should get some training. So I signed up and applied to the LSU Fellowship and got accepted. So I spent a year in New Orleans learning about hyperbaric medicine from Dr. LeGros. Then I moved back to Lafayette, and I was still seeing all these commercial divers. And then the economy started getting bad. And shortly before COVID hit, I was recruited for a secret mission at this hospital. So what's the secret? Well, it's this hyperbaric chamber. When I got here, there were a lot of doctors in the hospital that didn't even know we had a hyperbaric chamber. This huge thing is almost 30 feet long on the ground floor inside of Turner Tower. But people didn't know about it. So I was charged with educating the doctors here at the hospital and in town about what we do. We have the only multi-place hyperbaric chamber in the whole state. Mississippi doesn't have one, Arkansas doesn't have one. Other hospitals have these monoplace chambers. Methodist North has these made by Seacrest, and other hospitals have these monoplace hyperbaric chambers. Let's look at all the indications. Air or gas embolism. We've only had 7 of these in the last 5 years since I've been here. I'm going to tell you about a case in just a little bit. Carbon monoxide poisoning. We get a lot of those in the wintertime. Gas gangrene, crush injury, compartment syndrome, those kind of go hand in hand. Decompression sickness. Thought I gave you all hints with the commercial divers. Central retinal artery occlusion. A little blood clot to the eye, the blood vessel that goes to the eye, causes sudden blindness, where we can give oxygen, keep that tissue alive. Necrotizing infections, severe anemia, intracranial abscess, refractory osteomyelitis, that's the infection in the bones, delayed radiation injury, we mentioned that. We have delayed grafts, or compromised flaps and grafts, acute thermal burns, idiopathic sudden sensory neural hearing loss. This is a special kind of hearing loss where you lose your hearing just like that. And we've had at least one case that we helped bring most of their hearing back. Enhancement of healing in selected problem wounds, and then avascular necrosis is the latest indication. This is a picture of inside of our chamber. Inside of here, we can treat whole families that have been poisoned with carbon monoxide, or patients on ventilators that have necrotizing infections or maybe have compartment syndromes. I want to tell you about one of our patients, Marvin. Marvin was 57 years old and working in a local factory when he developed cancer of the vocal cords. He was treated with radiation and was doing great. All the cancer was gone. And 6 months down the road, he started having trouble breathing. He was at work one day, and his employer sent him to the hospital where he was admitted into intensive care for this emergency tracheostomy. Marvin couldn't breathe. He had so much swelling of the vocal cords. So his doctor sent him to our hospital where we started giving Marvin treatments. Now, the first day I saw Marvin, he was carrying a bag like this, and he was coughing and spitting into this bag during the whole examination. He was having a lot of secretions. So we started Marvin in treatment, and after 2 weeks, the bag was gone. He was no longer having secretions. After 6 weeks, tracheostomy was gone. And after 8 weeks, Marvin was released back to work. And that's all he wanted, was to go back to work. Let's talk more about oxygen. let's say we're at sea level. At sea level, you have about 21% oxygen. This is Mount Everest Base Camp. There's only 11% oxygen here. Half the people that go to Mount Everest Base Camp will get altitude sickness, the effect of hyperbaric, low pressure, not enough oxygen to give you a sustainable concentration of oxygen to live. Well, low oxygen causes other problems like dry gangrene of the feet. I see this in this hospital almost every day, and we certainly see this in wound care. So what about giving more oxygen, increasing the amount? Well, oxygen is a drug. Too much is toxic, but not enough and you die. The main toxicity that we worry about is seizures. Although it's very rare, we've had one in the last 15 years. If we think of oxygen as a drug, you can increase the dose to get your desired effect, but you got to be respectful of those side effects. If we dose it in the right fashion, we can use oxygen under pressure hyperbaric conditions to treat certain conditions for relatively short periods of time. Pulsed hyperbaric oxygen. Oxygen tension in tissues increases tenfold with the use of pressure. This is a picture of the eye. I mentioned central retinal artery occlusion. We can keep retinal tissues alive while the retinal artery heals and gets blood flow, and we restore their vision. We treated actually a physician here at our hospital, and we got that physician's eyesight back to 20/20 with a series of treatments. Sudden sensory neural hearing loss is thought to be caused by inflammation of the cochlea and the auditory nerve. Well, hyperbaric oxygen reduces inflammation. So we get better than 85% positive results when we combine hyperbaric oxygen and steroids to treat this condition. I'll tell you about another patient. Call her Mrs. E. I got a call late one night from an emergency room doctor in Hattiesburg, Mississippi. She told me about Mrs. E, who had a procedure. She was having a lung biopsy, and during her procedure, she developed an altered mental status and shortness of breath. They did some imaging and found out she had a pneumothorax, a collapsed lung, and air in the brain. Well, she was admitted to their emergency room, and they started calling around different emergency rooms or different hospitals to get her treated with hyperbaric oxygen. They called at least 10 hospitals, and 10 hospitals declined acceptance. And then they called us. This was like 12 hours after her procedure, and they called me, and I said, yes, we'll take her. And the doctor said, well, is it too late? Are we just spinning our wheels trying to treat this lady? I said, delayed treatment is better than no treatment. And if it was me or my family member, I'd certainly want treatment. So Hattiesburg is like 4.5 hours away. So they made arrangements to transfer her, put her in an ambulance. She's on a ventilator, she's intubated, she's on Levofed because her blood pressure is so low. She's on sedation, and she's got a chest tube. So they make the trip up to Memphis to our hospital. Now, the treatment for this condition is 6 hours. So we started her treatment about 24 hours after her procedure. So this is quite delayed treatment. You try to get them in as soon as possible. So our critical care nurse had to spend 6 hours inside the chamber with this patient, adjusting the medications, adjusting the ventilator, and keeping this patient alive till we got her treated. Well, when she got out, there's no way for us to tell whether we did any good because with the sedation, we could not do a neurological exam. We couldn't tell if her altered mental status was better. But we did do some imaging, and all the air in her brain was gone. So they started weaning her ventilator and her sedation, and the next day they pulled her into tracheal tube, and she was awake, she was alert, and her neurological exam was normal. I asked her family who was there, I said, well, you think she's back to normal? Well, yeah, but she's just not as ornery as she used to be. So how do we do this? What's the mechanism of treatment for this condition? Well, we're shrinking bubbles. This is a bubble disease. We're shrinking them and we're dissolving them. I'll show you how. So let's just say we have a bubble that's 10 mils. For hers in her brain, it can be other places in the body. Let's say we apply pressure, and the pressure we use to treat this condition is 2.8 ATA, or 60 feet of seawater. Well, if we apply pressure, we're going to shrink this bubble from 10 mils to 3.6 mils. So, does anybody know the gas law that does this?
The Boyle's law?
Give them another prize. Very good. You study, like I can tell.
I'm actually a lawyer, not a doctor. It's very interesting.
All right. So let's talk about another gas law, and we call it, in the hyperbaric world, the oxygen window. So here we have this bubble. What is in that bubble? Well, it's air. So it's 79% nitrogen, 21% oxygen. So I'm going to use green to represent oxygen, and we're going to flood all the tissues surrounding this bubble. So there's 100% oxygen surrounding this bubble that's made of air. So there's another law called Fick's law. Fick's law has to do with the diffusion of gases. It goes from an area of higher concentration to lower concentration. So we get nitrogen coming out of the bubble, and we get oxygen going into the bubble. So sooner or later, our level of nitrogen goes down, our level of oxygen goes up, and pretty soon we have all oxygen in this bubble. Well, guess what? The body can metabolize oxygen. So over a period of time, this bubble gets smaller and smaller, and then it goes away. It's magic. Let's talk about contraindications for this treatment. Anybody know the only one absolute contraindication? Cindy, I'll let you answer.
Pneumothorax.
Yes, untreated pneumothorax. Give her a prize. So our lady, Miss E, that had the gas embolism into the pneumothorax, her pneumothorax was treated with a chest tube, so she was able to go in the chamber. As long as it's been treated, then we can treat these people in the hyperbaric oxygen chamber. Now let's talk about stem cells. Stem cells are the building blocks of healing tissues. We can see that after a single hyperbaric oxygen treatment, we double the number of stem cells circulating into the bloodstream. And after 20 treatments, there's 8 times the number of stem cells circulating as before you start the treatment. Now this is a graph that shows oxygen tension in the tissues. Up on top here we have normal tissue. You would expect it to be around 100%. Down on the bottom is tissue that has been through radiation. It's only around 30%. And when we start this hyperbaric oxygen, after about 4 weeks or 20 treatments, we get that oxygen tension up to 75 to 80% of normal. Now, it'll never get back to normal, but it does a lot better. And this is the effect of growing blood vessels, angiogenesis. And look at this. Years down the road, even after you stop the treatments, that oxygen tension stays quite high. Let me tell you about Emma. Emma was 3 years old when she developed a tumor called a craniopharyngioma. This tumor sits between the pituitary gland and the optic nerve. It can cause hormonal problems and vision loss. Emma came to St. Jude for treatment, and they treated her tumor with radiation. By the time they finished treatment, her tumor was not detectable. So Emma goes back home, but 6 months later, she starts developing vision loss. She comes back to St. Jude. They do an MRI. They see all these white lesions in her brain. This is the effect of radiation, and it's affecting her optic nerve. So they sent Emma for treatment, and we started her, and after 20 treatments, they did another MRI. All these white spots were faded. After 40 treatments, they were all gone. But Emma didn't have her vision back just yet. She went back home, and 3 months later, she got all of her vision back, all because of hyperbaric oxygen. Now, work and health are just small parts of the quality of life. We have all devoted our careers to improving people's quality of life as far as health goes. When I see people like Emma and people like Marvin, it improves my quality of life. And that's why I love my job at Regional 1. So maybe you know a Marvin, or maybe you know an Emma. Maybe you will remember that there is help with hyperbaric oxygen. Now, I'm not a witch doctor, and I'm not a wizard, and I'm not a magician. But when I see the results that we get from hyperbaric oxygen, and especially my patients get those results, it is magic. Thank you.